So lung-around cell leukocytosis is one of these histiocytic disorders, and it can affect children and adults. The incidence in children under the age of 16 is about 4 per million, which translates into about 50 new cases a year in the UK. Yeah. We think that the incidence in the adult population is probably about the same, isn't it?
Although some might not be diagnosed, so it's difficult to know. We don't have the data for adults as clearly as we have for children.
Yeah, and we know that the common systems affected would be the skin, the bone, in adults the lung, and then a multitude of other systems which we will talk about. I wonder if you could start talking about the symptoms of relating to the skin.
With skin involvement, especially in infants, they're very, very similar to normal baby conditions. So cradle cap, nappy rash. The cradle cap can be quite severe and often doesn't respond to normal sort of treatments like olive oil that parents use. Again, similarly with nappy rash, if it's persistent and causes a lot of discomfort where it's oozing and weeping, you need to consider whether this may be something else rather than standard nappy rash. Children can get eczema-like rash again, and adults as well. But quite often it's very severe, especially in the creases, and you get these wet areas that ooze. They don't tend to respond to emollients, they don't tend to respond to steroid. And so any rash, if it's persistent, is causing a lot of problem and doesn't respond to standard therapy, I think should be referred. Some of the children get oozing from their ears, and some of it's because of the skin of the ear, and some of it's because of middle ear involvement. And any child who has recurrent what is termed ear infections with draining ears and a lot of debris in the ear canal, again, one would have to consider LCH because this is a very common presenting feature.
And again, it's the persistent nature of it and not responding to normal measures which should trigger the referral. Mm-hmm. I think the next group of symptoms is caused by bony involvement, and in infants we often see a localized swelling, which parents might put down to a bump to the head because they fell over. But if these swellings persist, then they need to be investigated further. Interestingly, the skull itself is quite often involved, isn't it? Mm-hmm. And it may not be a swelling, it may actually be an indentation on the skull vault. We've even seen patients with proptosis because of bony involvement. And then actually all the other bones in the body can be involved.
Yeah. And sometimes it could be persistent back pain. You can get pain in one of the limbs. And if it's persistent in the same area, then you need to consider it. Some children present with a limp, a sudden new onset limp with often no history of trauma. And then again, you'd have to think about referring them on. Same with adults, really. Any persistent pain in any part of the body that isn't explained, and where parents bring children back again and again, either to the A&E or to the GP, I would suggest should be referred in for further investigation.
And I think we have to recognise that most of the time it's going to be another condition, but some of those other conditions are equally very serious and need to be diagnosed. The jaw and the teeth are often affected as well in LCH, and classically people describe that their permanent teeth suddenly become loose, and without any explanation. Sometimes that's associated with gum involvement as well, but not necessarily. And those patients need to be referred to a dentist
or the maxillofacial surgeon. And what they will describe is floating teeth. So when you get an X-ray, the teeth seem to be just floating with no bone around them. Interestingly, babies who are born with a tooth sometimes may be a sign of LCH. We haven't really understood why, but we have had some parents who then report that their baby was born with a tooth.
That's very interesting. Now the lung involvement we actually don't often see in children, but is the most common involvement in adults. Single system involvement in adults. Almost all those patients would be smokers, and the X-ray appearance is often quite typical of LCH. radiologists would then suggest a CT scan to confirm the appearance, but patients often present with shortness of breath or a reduced exercise tolerance. And those patients, although many other things can cause that, need further investigation, in particular a chest X-ray.
A chest X-ray, yes. And with children, the lung symptoms don't tend to be as much of a problem. But the time you would think about it is when they've got lots of other systems involved. And as part of the workup, when they've had a chest X-ray, you may then find the lung changes there, incidentally with or without many symptoms. But with the adults, it's quite classical that it can be the only part of the body that's affected.
Yeah. Now, when a GP examines a patient and they find them to have an enlarged liver or enlarged spleen, then that needs further investigation, clearly. And again, it can be caused by so many other things, but LCH can cause both hepatomegaly and splenomegaly. Involvement of both those organs in LCH is indicative of a more serious form of the disease, which makes it even more important that that diagnosis is made quickly.
I mean, patients may or may not have jaundice at the time, but even without jaundice, it is a worrying symptom.
Yeah.
And quite often they may have bone marrow involvement, as you've probably found, when they have the liver and spleen involvement.
Indeed. Which again is an indication of a more severe form of the disease. So patients with some of these symptoms clearly need a few blood tests, which include doing liver function tests and a full blood count. And if they have cytopenias, either 1 or 2 or 3 of the cell lines affected, then that would again support the diagnosis of LCH. The other thing that I've come across in children, but not so often in adults, is persistent diarrhea and malabsorption. And failure to thrive. Yeah.
Some of them may have blood in the stool, but sometimes it's just diarrhea. A few of them may just not gain weight, and of course then it's difficult to know whether it's just the chronic disease that's causing them not to feed as well and not gain weight. But any of these children who have persistent diarrhea, especially if you have other features, so if you have the skin rash or a bony lump or the ear infections, then putting those symptoms together and considering LCH, that then makes the possibility of LCH much greater.
Indeed.
And gut involvement is often missed because you don't think about it, but it's something that can cause quite significant illness.
Yeah. Another area of mucosal involvement that is sometimes seen in adults is vulvar involvement. And
that's really difficult to manage and can be very painful,
Yeah.
quite debilitating. And that's one of the symptoms that I would suggest that you refer on quite early, rather than trying what would be considered standard treatments in primary care, because it's very, very difficult to manage and can cause scarring and long-term problems. So it's always useful to refer them up early for more intensive treatment.
Yeah, I mean, I would expect that GPs would do whatever is usually the first line of treatment, but if that doesn't work, then
I think earlier referral would be helpful.
Indeed. Now, when patients suddenly start to drink a huge amount, that clearly points to something that you're very interested in.
Excessive thirst and passing large volumes of urine, so polyuria and polydipsia, are very, very classically associated with LCH. Now, in the majority of patients who present to primary care, these symptoms would point to diabetes mellitus, and that's what most GPs would consider. And the first thing they would do is test the urine by a dipstick and look for sugar. And if there's no glucose there and there's no sign of infection, then you don't think necessarily any further. You might do a blood glucose level, and again, that would be normal. So if it isn't diabetes mellitus, which is the common condition that you're used to, consider diabetes insipidus. And this is because of involvement of the posterior pituitary, very classically, as LCH is probably one of the most common causes for it. So although it's a rare condition and diabetes insipidus is very rare, the combination of the two makes one consider LCH. And what is unfortunate is that even in patients who have got a diagnosis of LCH and everybody knows about it, even with them, the diagnosis of diabetes insipidus is often delayed because these are toddlers and they've been unwell, and quite often these are features that people would associate with habit and comfort. So they're always going around with a bottle in their mouth. They drink a large volume of water, milk, day and night. But one needs to consider whether there's an underlying abnormality rather than just getting into the habit of drinking too much and managing this behavior, rather than considering what else might be wrong. I mean, we've had children who drink out of any possible source of water, so bathtubs, goldfish bowls, puddles, and when that's unusual pattern of drinking water, then really one needs to consider this.
So I think really what we're saying is there's a wide variety of symptoms. If these symptoms are persistent or severe and not responding to the usual measures, then it needs further investigation.
And if they coexist,
Yes.
it's more than one of them. So one of them by themselves may be a common childhood condition. When they're all together, think about it. Especially with parents who really know their children. And if they're coming back for help again and again, either to primary care, to A&E, to the pediatric team, or with adults who present again, you need to think about whether there's something else. I mean, it might not be a histiocytic disorder, it might not be LCH, but it certainly requires a referral and further investigation.
Yeah. And for children, we would expect that to be to the local pediatric team, and for adults to the appropriate specialist team.
Because it's different. You know, it could be the lung specialist or the endocrinologist or skin. So it depends on where it is.
Yeah.